Welcome to Raaonline. Today's lecture is about inguinal canal. This is an important essay question for both undergraduate and postgraduate. The thorough knowledge of inguinal canal anatomy is very essential for the surgeons who operates inguinal hernias. The competency we are going to cover under this topic is describe the extent, boundaries, contents of inguinal canal including Hasselbalch's triangle. The second competency is explain the anatomical basis of inguinal hernia. We will start the discussion with clinical case. A 65-year-old man came to the surgical OPD with complaints of swelling in the left inguinal region with a history of chronic cough was present. On examination, the surgeon noted a lemon-sized swelling which is present above the pubic tubercle. The swelling increased in size during coughing. What is the probable diagnosis? So here the clue for this case is the swelling was present in the left inguinal region. The other clue is the chronic cough history was present. On examination, the swelling was present above the pubic tubercle, and also the swelling was increased during coughing. So with this possible clues, we can diagnose this is a case of inguinal hernia. So we are going to see the inguinal canal under these following headings. First is the extent, boundaries, contents, Hasselbalch's triangle and inguinal hernia. In this first session, we are going to describe about the extent and boundaries of the inguinal canal. So what is inguinal canal? This is the inguinal region of the right side. You can see the inguinal canal content was reflected to show the inguinal canal. So this inguinal canal is present in the groin region, which is a natural passage present between the anterior abdominal wall muscles. This inguinal canal is present just above the inguinal ligament, and it is also parallel to the inguinal ligament. So you can see the inguinal ligament attachment which is from the anterior superior iliac spine to the pubic tubercle. So the relation of inguinal canal with the inguinal ligament is it is just above and parallel to the medial half of the inguinal ligament. So this is an oblique tunnel which resembles that of the oblique tunnel which is seen in this image, which is about 3 to 6 centimeter long. So what is inguinal ligament? So in this picture you can see the inguinal ligament which is a thickened lower border of the external oblique aponeurosis of the anterior abdominal wall muscle. This ligament is also called as Paupart's ligament. So this ligament extends from the anterior superior iliac spine up to the pubic tubercle, which is a protrusion present on the pubic bone of the hip bone. And you need to remember what is mid-inguinal point and what is the midpoint of inguinal ligament. So the mid-inguinal point is the midpoint from the midline, that is the pubic symphysis to the anterior superior iliac spine, that is called mid-inguinal point. So when you take a midpoint between the pubic tubercle and ASIS, this midpoint is called midpoint of inguinal ligament, because the inguinal ligament is getting attached up to the pubic tubercle, not up to the pubic symphysis. So there are modification of the inguinal ligament which you will see on the medial end of the attachment of inguinal ligament. Here in this picture, the blue color structure represents one of the modification of the inguinal ligament known as lacunar ligament. The other ligament which is extending above on the brown color, it is represented. This ligament is called reflected part of the inguinal ligament. The other ligament which extends from the lacunar ligament is called peritoneal ligament of Cooper. So as you see in this picture, in the right side the inguinal ligament was removed. So this is anterior superior iliac spine. This is anterior superior iliac spine where the inguinal ligament is getting attached, and this is a pubic tubercle where the medial end of the inguinal canal is getting attached. So on the left side you can see the ASIS to pubic tubercle. The inguinal ligament is attached here. This is the inguinal ligament, and from the inguinal ligament, this ligament which is extending posterolaterally is the lacunar ligament. When you see the ligaments which are extending from the base of the lacunar ligament, this part of the ligament is called peritoneal ligament of Cooper. So these are the three modification of the inguinal ligament. First one is the lacunar ligament, and this is the peritoneal ligament of the Cooper, and also you can see the other extension, that is a reflected part of the inguinal ligament. So these are requisite. So these structures are important to learn the inguinal canal. So what is the direction of inguinal canal? So you can see the highlighted green color structure here, that is the inguinal canal. The direction of it is facing downwards, forwards and medially. So what is the extent of this inguinal canal? So it extends from the deep inguinal ring, which is present laterally and also in the deeper plane, and it extends up to the superficial inguinal ring, which is present more on the medial side as well as on the superficial plane. So the length of the inguinal canal is not same for all the individual. It depends on the age. The length of the inguinal canal varies. Normally in adult, the length of the inguinal canal is about 3 to 6 centimeter. So you can see with simple picture, you can remember the extent of the inguinal canal here. So this is the point of ASIS. This is a pubic tubercle. So between these two, there is a inguinal ligament attached here. Just above the medial half of the inguinal ligament, you can see the location of the inguinal canal, which is extending from the deep inguinal ring to the superficial inguinal ring. If you see the location, the deep ring is more on the lateral plane, and the more medially you can see the superficial inguinal ring. So in this picture, the oblique tunnel, so the deep inner opening, here it is representing the deep inguinal ring. This is a deep ring, and the superficial one here it is called superficial ring. So there are the peculiarity of, what are the peculiarity of inguinal canal? This canal is present in both the sexes, but it is well developed only in the male. In female, this inguinal canal is narrower. Because of this, the chances of inguinal hernia is very rare in case of female. In newborn, since the anterior abdominal vessels are not well developed, both deep and superficial rings are superimposed with each other. So the canal is extremely very short. It is only about 1 centimeter in length. So because of this, in newborn, the inguinal canal is almost straightforward.